Every woman will experience menopause at some point in her life, and it's an essential conversation we need to normalize and bring into everyday dialogue. Menopause is medically defined as the stage when a woman has not had a menstrual period for a full year, with the average age for this transition being around 51. However, what many don't realize is that symptoms can start far earlier, often up to a decade before menopause actually occurs. This stage is called perimenopause and is marked by a wide range of symptoms that may at first seem subtle. Periods might start to become irregular, showing up earlier or later than expected, becoming heavier or lighter, and eventually becoming more spaced apart. Alongside these changes, many women notice things like increased irritability, mood swings, difficulty sleeping, mental fog, and even hot flashes, which aren't always the dramatic sweats we often see depicted. Every woman will experience menopause at some point in her life, and it's an essential conversation we need to normalize and bring into everyday dialogue. Menopause is medically defined as the stage when a woman has not had a menstrual period for a full year, with the average age for this transition being around 51. However, what many don't realize is that symptoms can start far earlier, often up to a decade before menopause actually occurs. This stage is called perimenopause and is marked by a wide range of symptoms that may at first seem subtle. Periods might start to become irregular, showing up earlier or later than expected, becoming heavier or lighter, and eventually becoming more spaced apart. Alongside these changes, many women notice things like increased irritability, mood swings, difficulty sleeping, mental fog, and even hot flashes, which aren't always the dramatic sweats we often see depicted. Some people try to sell expensive hormone panels or testing kits to determine where you are in your hormonal cycle, but these tests aren't always reliable because of how dramatically hormone levels vary from day to day. Rather than relying solely on lab tests, tracking your symptoms over time gives a more accurate picture. Many women describe feeling not like themselves, which is a common and powerful way to understand this phase. You may also notice things like dry or crepey skin, frozen shoulder, general aches and pains, or muscle stiffness, which aren't always linked to menopause in common discourse but are very real signs. The good news is that there are ways to manage and treat these symptoms. Hormone replacement therapy, or HRT, is an FDA-approved treatment for symptoms like hot flashes and bone loss prevention. However, that doesn't mean it can't be used for other symptoms if appropriate. If you're considering HRT, it's important to have a comprehensive discussion with your doctor or a certified menopause specialist. If you still have a uterus, estrogen therapy must be paired with progesterone to protect the uterine lining. These hormones can come in various forms, including gels, patches, pills, and injections. Progesterone also comes in pills and patches, but topical creams have not been shown to be effective. In some cases, low-dose testosterone may also be used, especially to improve libido or overall energy and well-being. These treatments should always be personalized and discussed with a healthcare professional. For those looking for experienced guidance, the Menopause Society's website is a great resource to find certified practitioners in your area. Another listener shared a concern about experiencing sharp pain during penetrative sex, despite being attracted to men and enjoying oral sex. She said that even average-sized partners caused her pain, and she worried her vagina might be too. She also noted she's tried over-the-counter lubricants with no success. This is another deeply personal issue, and unfortunately, one that many women silently endure. The truth is, sex should never be painful, and if it is, it's a sign something needs to be addressed, not a reason to feel shame or blame yourself. One of the most common causes of painful sex is inadequate arousal. When a woman becomes aroused, the vagina naturally elongates and widens to prepare for penetration. If intercourse happens before this process is complete, the body isn't physically ready, and penetration can be uncomfortable or painful. For some women, full arousal can take up to 25 minutes, which means rushing into intercourse without that time can lead to pain. Lubrication also plays a major role. Many women use water-based lubricants, which are widely available and easy to use, but they tend to evaporate quickly and often need to be reapplied. Silicone-based or oil-based lubricants last longer and may provide more consistent comfort throughout intercourse. Another possible cause of painful penetration is pelvic floor dysfunction. The pelvic floor is a group of muscles that support the bladder, bowel, and reproductive organs, and just like any other muscles in the body, they can become tight, weak, or uncoordinated. High-tone pelvic floor dysfunction means these muscles are too tight, which can make penetration extremely painful. This condition is also often associated with urinary frequency, urgency, constipation, hip or lower back pain, and more. The challenge is that many women aren't aware these muscles exist, let alone that they can be the source of their discomfort. Evaluation by a pelvic floor physical therapist or a healthcare provider familiar with pelvic health can make a huge difference. Treatment often involves physical therapy that focuses on releasing muscle tension, retraining the pelvic floor, and helping pat, such as vestibulodynia or pudendal neuralgia, which involve the nerves or tissues around the vaginal opening. These conditions require more specialized evaluation and treatment but are absolutely manageable with the right care. Some women are concerned that their anatomy is simply incompatible with their partners. While vaginal sizes can vary, the average resting vaginal length is about 3.7 inches, or 9.5 centimeters. During arousal, the vagina can lengthen by 1.5 to 2 inches, making it very accommodating. Most couples are anatomically compatible, but in rare cases where a partner's penis is significantly longer or wider, sex may become uncomfortable. In such cases, products like Onnit, a wearable buffer ring, can be used to limit the depth of penetration and make sex more comfortable. It's not talked about often, but tools like these can make a huge difference. Lastly, one listener asked about cloudy urine, saying that it appeared gray and murky for about a week, but without any accomp. Urgency, or lower abdominal pain. While cloudy urine can certainly be concerning, it doesn't always indicate a problem, especially in the absence of other symptoms. Urine can become cloudy for many reasons. Dehydration is one of the most common causes, especially if you haven't been drinking enough water. It can also result from something you ate or a supplement you're taking. If the cloudiness is accompanied by a foul smell, it could be a sign of a urinary tract infection, but not always. It's worth noting that urine isn't sterile, as was once believed. A small amount of bacteria is often present, and in fact, around 40% of mild urinary tract infections can resolve on their own without antibiotics, thanks to the body's immune system. If you do notice changes in your urine but don't have any discomfort, try increasing your water intake and monitoring for changes. If the cloudiness persists or you start to notice pain, frequent urination, or blood in the urine, it's time to check in with. They can run simple tests to rule out infections or other underlying issues like protein or blood in the urine, which may need further evaluation. These questions reflect the kinds of concerns many women have but don't always feel comfortable bringing up. Whether it's menopause, sexual discomfort, or changes in urine, these issues are all part of women's health, and it's time we treat them as such. If you're experiencing any of these symptoms, please know that you're not alone and that help is available. Seeking out a provider who takes your concerns seriously and understands the nuances of women's health can make a world of difference. If you'd like to be part of future Q&A sessions or gain access to additional resources, early episodes, and ad-free content, consider becoming a premium member at renamalik.supcast.com. And above all, remember to care for yourself and prioritize your well-being, because you are absolutely worth it.